The goal to provide quality services and, patient customer service. I mean, our goal here is to, to be the best.
We want to be the model for how healthcare is delivered in rural America.
I think it's quite possible that by this time next year, we will be the tail that wags the dog. That we will be going to the national meetings and we will be sharing our data and people will be lining up. How did you do that?
The future is bright here. I see it growing and becoming perhaps even a mecca in the healthcare field in this region.
St. Lawrence Health System was an organization that was formed several years ago for the purpose of increasing access to care, raising the quality of that care, and also of adding new services to be available to the residents of St. Lawrence County.
What used to be possible more locally and with a smaller group of physicians and a healthcare system is really hard to do now.
Having a hospital system that works with the county rather than individually fragmented hospitals trying to compete with each other in a non-productive way really doesn't benefit the patient.
We're responding to the economies of scale that are necessary for small hospitals to survive.
I think that we have to think about the needs of the larger community and how we deliver care more in a more systematic way, in a way that's more cost effective, and a way that puts the least amount of burden on the patients and their families.
I think if you look at St. Lawrence County, it's an extremely large geographic county, largest in the state of New York. And it is also by far the most isolated from access to tertiary care. So the significance of the system is to make certain that access is expanded, that those specialties that weren't here before are now here, because that infrastructure that's available to deliver care needs to be expanded to meet the community's needs.
The St. Lawrence Health System, to me, is one of the first moves that I know I'm aware of, and again, I've been here for 10 years, where there has been an attempt to, you get a sense of this community in regards to medicine, attempt to draw people together instead of divisions.
If the health system hadn't been established to unite Gouverneur Hospital and Canton Potsdam, Gouverneur Hospital wouldn't exist, and we wouldn't have the ability to provide care for patients in the area.
Now we've got new services that we've really never had before, such as oncology, pain management, sleep lab. We've expanded our offering in terms of space for the physicians as they rotate in and out of the hospital. We've got the community health center that's part of our organization now, that's renting space from us and providing care to the community of Gouverneur. All of those things have been huge benefits, especially the fact that the hospital is still open.
It completely changes what happens to healthcare in St. Lawrence County. We can now recruit specialists that we've never had before, including endocrinology, rheumatology, allergy and immunology. People that need a larger number of patients to have a full practice are now here.
For subspecialists like myself to support a practice, you need a large volume of patients. And the nice thing about St. Lawrence Health System is it provides us with a bigger area to get the patients to see me.
It requires about 50,000 plus population to support one allergist. And you also need a good referral base. And the system that CPH has designed give me access to this referral base, and that helps me a lot.
The St. Lawrence Health System really helps people from this greater area get local care. And by being here and providing this care, the people from this area don't have to travel vast distances to get to a cardiac electrophysiologist to have their cardiac device monitored and taken care of, and they can do that on the local level, which saves people a lot of travel and money eventually.
I think that the significance of the project in Canton is primarily that it's a center of the county. it provides a location that is accessible to all 112,000 people in this county.
Having a very strong health system here in our region really helps the colleges recruit the best and brightest faculty and students to our region.
Coming right out of school at Clarkson University, I wanted to join this health system because I thought that it was a great place.
We manage a lot of sicker patients at this hospital in particular, whereas before transfer rates were much higher.
I think the community has quite a bit more trust in the hospital. One of the things I've seen in the past 2 years is at first like 70% of the patients wanted to go to other hospitals. Now, that number is completely reversed to where about 90% of our patients want to come to Gouverneur Hospital for their care.
But I think professionally, both the nursing staff, respiratory, this hospital has stepped up its game in regards to the kind of quality that we have here.
The quality of care has improved drastically.
We do a lot of measures with population health, and we try to improve the health of not only the folks who we have direct contact with in the clinic, but also to try and create different measures and do different things to help improve the health of not only the folks that we serve, but also the health of people across the system.
If people are sick, we have the expert technology, the expertise, the collaboration with other teams to take care of the people that are very sick. But it is a lot more efficient to prevent the disease rather than treat it after the fact.
Our patients are able to understand how their illnesses impact their life and how to minimize those impacts on their daily life. An example of that might be one of our health coaches recently helped identify with her patient that she wanted to be able to climb the hill next to her house to visit her children. Through strategies that were worked out in a stepwise program, that patient was able to achieve that goal, and she and her health coach actually climbed that hill on their last visit.
Research has recently shown that we have decreased length of stay, which equals less time spent in the hospital, as well as for observation patients, a smaller bill. We can get you home better, healthier, and faster.
I think the health system provides a much further reach and really expands the critical mass that the healthcare system in our county provides. In doing that, I think everyone benefits.
The St. Lawrence Health System gives us an opportunity to have a healthier workforce, and that's attractive to existing employers and businesses looking to move here.
St. Lawrence Health System has really been a positive influence on the Gouverneur Hospital and given me the ability to continue doing the things that I love to do where I want to do them.
This institution is really going in a direction that no other hospital in this region is experiencing right now.
Coming here, I had very high expectations for this health system, and all my expectations have been either met or exceeded.
We've reached a point where you have a significant enough critical mass of specialty physicians, of specialty services, that you really have this window in time when you can take it to the next level. And we're at that moment. We're at that window.